This is everyone's Oprah moment. This is your Oprah moment. So that was a powerful 20 minutes. Before I lead off the conversation for the next little while, I just want to welcome a new part of the audience that none of us here in the room this evening in Vancouver can see. I think all of us are aware that sometimes there are barriers to being able to participate in an evening like this. Sometimes it's a social or emotional barrier. Sometimes it's a geographic barrier. But we wanted to make this series and tonight as inclusive as possible, because we really believe that the more people that we can include in the conversation, the better. And we've been very fortunate to work again tonight with Bob Baker, Creative Connections, and his team. They are live streaming now this across the province of British Columbia, so that we have an opportunity for people young and old, all genders, all cultures, all faiths, to be able to join in the conversation. So I want all of you, whether you're here in the room with us or watching, to join me in welcoming three guests that we have to join us for the first part of this evening. Tyler Middleton in the middle, sort of self-obvious because he's the only male on the panel. Tyler is a radio host with the Peak radio station, and I'm going to let everybody say a little bit more about themselves, but just as a fun fact that some of you may not know is that Tyler not only is a well-known celebrity radio host, but he actually drove a Zamboni for 5 years in his hometown of Orono, Ontario. So if anybody wants to chat with him about being a Zamboni driver for 5 years, you have the break to have that conversation with Tyler. On my immediate left is Suzanne Sagmeister. Suzanne is a photographer and an author, and she also, like Tyler, brings a personal story to share with us this evening. Suzanne often forgets to bring her hairbrush to events like this. I know you're all wondering where I'm going with this. And tonight was no exception. She arrived here and she realized that she had not brought her hairbrush, so she actually used a toothbrush to brush her hair so that she would look absolutely spiffing perfect for us all this evening. Welcome, Suzanne. Jane Holland, on Tyler's left, is a very well-known advocate in the disability movement here in British Columbia. And Jane and I actually have seen each other in another movie quite a few years ago, before Tyler was born, actually. And Jane has, as I said, is very, very well known in the disability movement here in British Columbia. But aside from that, she's also off to Nepal next month on a 26-day trek. So if you've been there, you can chat with Jane, or if you want to go, you can chat with Jane, also at the break. Suzanne and Tyler and Jane have all been impacted by suicide in different ways. So instead of me introducing them at length, I'm going to ask them a few questions so that all of us can get to know them a little bit this evening. So I'm going to ask Tyler, and then Suzanne, and then Jane, what connects you personally to tonight's topic?
Hello, everyone, by the way. Thank you very much, Barbara, for everything you've organized here tonight, and you're mediating. The documentary is amazing. My personal connection with suicide is I lost my father to suicide at the age of 8. I, however, didn't know that it was suicide. I was told that he had passed away in a different, it was an accident. And then when I was 22 years old, I was a few years into my own battles with depression and anxiety, and I was looking to find out a little more about my family history and what I needed to do when I was ready to help myself. And in that process, I actually learned about what had happened to my father, which I think says a lot about the stigma that even my family didn't feel comfortable telling me that at that age. And ever since, I've gone through my therapy, and I've helped myself out of that hole that I was in. And now I've try and take advantage to speak publicly about it whenever I can, to let people that know that they're not alone in these difficult settings.
Hi there, I'm Suzanne Sagmeister, and just want to say thank you for having me here in Vancouver. I've been affected by suicide since I was 6 months old. My dad was a first responder, and he and his partner were transporting a patient to a hospital in Edmonton when a man intent on taking his life pulled out in front of my dad's ambulance and killed everybody except for my father. Of course, at that time of my life, I could have no clue how that was going to impact me. And I actually didn't uncover that until I started doing what I did do, and that was I went to every province and territory in Canada, and over a 4.5-year time period, I interviewed survivors of suicide loss and suicide attempt and created a book. And through that process, I was going to have a gallery exhibit, and 8 weeks prior to the gallery exhibit, there's 550 tickets. They were all sold out, and then 4 weeks prior to the exhibit, my son's father took his life. And my son actually became the 25th suicide survivor that I photographed. I myself, too, have suffered from suicidal ideation, and I get it. And that's why I'm here. Thank you.
Hello, everyone. It's a relatively new area for me to be involved in, and what connects me to this topic is my granddaughter, who is 28 years old. Stephanie came to live with me when she was 5 years old, so I play the role of parent and grandparent, and she has had 5 suicide attempts in the last 2 years, and the last one occurred when she was in hospital. So it's been a new world and quite a journey for both of us. And I'm happy to be here and to share my thoughts, even though I'm a relative newcomer to this area. So thank you.
So the 4 of us are going to have a bit of a conversation, and in a few minutes we'll take a break, and people can get a coffee or water or some more cookies. The home audience will be able to watch a video while we're having the break here, and then we'll come back and we'll have an opportunity for you to have questions and for the panel to answer. And we'll have a couple of mental health professionals from Vancouver Coastal Health join us up here. So let me ask a question of you, Suzanne, if I can. In addition to your own struggles and your son's father who took his life, you've obviously had a lot of conversations with survivors within the suicide conversation and the people who've been left behind. And I'm wondering what's a conversation that's been a really kind of I get it moment for you, where there's been a bit of a beacon of light in helping you to understand the issue out of all of those conversations that you've had?
Thank you, Barbara. That's a great question. It's really hard to pinpoint because I did have some very pivotal moments over that 4.5-year period, but one of them came in 2017. My dad went in for open heart surgery, and he had a stroke on the table. And I spent the next few months in the hospital with him, finishing the book, actually. And during that time, I got to speaking with his doctor. And his doctor was actually my son's father's doctor as well. So it was these moments that we got to share and have this conversation. And he talked to me about how he went to a patient had died by suicide. And he was asked by the parents to come over during this wake and at their house. And he was so nervous, and he went and knocked on the door, and he says, I don't know what I'm going to say. Like, are they going to blame me? Like, why do they want me here? And so he walks in and he has this conversation with them, and they were very receptive, and they were asking like, how did we lose him? And he explained to them that just like somebody with cancer, we will lose some of them. There'll still be a courageous fight. You see it all the time after a long, courageous battle with cancer. Well, the same thing will happen with mental illness, is that there will be some that we lost, but it doesn't make their fight any less courageous. And there was just something in that understanding, and for me to realize that suicide is a symptom of mental illness, just like a fever is a symptom of a flu. And that understanding takes away the blame, it takes away the hurt, and makes it, I think, a little bit easier to process.
That's wonderful. Thank you so much, Suzanne. Tyler, you're a public person. I know that because your gorgeous mug is on the poster for this event. But you're quite public about your story and about your relationship with suicide and your family experience. What can you tell us about how you made the decision, being a public person, how you made the decision to talk publicly about it, and what impact it's had on you and the people around you?
The decision to talk openly about it on the air was probably the most difficult decision I've ever made about something to discuss on the air. And that includes the news every day, which can be awful at times. But because it was so close to me, it was really tough. But I got to a point in my life where I had enough of a grasp on my own battles with depression, and I had worked through the grief about learning about my father at an older age. And I really decided, you know what, like, it's my job to make people happy. That's all I want to do with radio. That's why I got into this industry. And if this is a way that I can hopefully help somebody and point them in the right direction, or at least let them know that they're not alone in this battle, and there's lots of people, even people that they could listen to on a regular basis, that have had these battles themselves and have had losses similar to a lot of our audience members, then that would be right for me to share that story. And then doing so, it ended up being an incredibly helpful and powerful process for myself as well. The reaction from the audience was incredibly supportive and also just overwhelming with the amount of people who had a story of their own that all of a sudden felt like sharing it with you because you had talked about yours. And for a lot of them, it was people I'd never met, and then it was the first person they'd ever told. And that was really powerful, and it felt like, okay, this is the right direction for me to take, especially being in my position. We get offered to do all sorts of charity work, but this is something that's incredibly close to me, and it seemed like the right direction for me to take that work. So,
thank you. Jane, you look after your granddaughter. She's a lucky young woman. And you are too. And as you said, she has attempted suicide and she deals with addiction. I'm wondering how you make sense of the impulses that she has. What's the sense making for you in walking this journey with her?
I had a conversation with her during her last hospitalization, and it was her fifth attempt, and trying to make sense of what was behind this, what drove it. And it was complicated again by her addiction, and her addiction really began to become very difficult for her after she discovered her mother's body. So that trauma associated with that was a huge catalyst for her. And she lived a life that was, fraught with, I think, a lot of decisions that she didn't feel that she had a lot of control over, people that were that she was spending time with. And she said to me at one time, she made these attempts because she was so afraid. She was afraid that her past decisions were, that people were going to kidnap and torture and kill her. And so in order to spare us having that happen and for her to experience it herself, that was what was driving her attempts to hurt herself. So it was a huge revelation for me, because I didn't have any idea or understanding of what this was, and so it was it's driven by fear and probably a great deal of pain.
Are we Are we at the moment now where we should break, or should we keep going for a couple minutes? Hello? Susan? Should we break now, or do you want us to keep going for a few minutes? Keep going. Okay. Pardon? Okay, I'm going to ask one more question. Of all three, I'm going to ask you all the same question. So for those of you that are at home, we just watched a short documentary called Four Sisters that's about 4 women living in Austin, Texas, all of whom have lost a sibling to suicide. And you may be able to find it online. And it walks through a bit of the reflective journey for each of those 4 sisters. They're not related to each other, 4 separate families. I'm wondering if there was one thing that resonated for you as a daughter, as a grandmother, as a son, as a family member out of that video that would be indicative for the people here in the room of what all of us have to learn from other people's stories. No, that was a surprise question.
A very big surprise question. That documentary actually was wonderful, and I think there was a lot of poignant moments in there. I loved listening to the one woman who gave the analogy on when you lose your spouse, when you lose your child, when you
lose your parent, you've lost your past.
Right.
When you lose your child, you've lost your future.
Yes.
When you lose your spouse, you've lost your present.
Yes.
When you lose your sibling, you've
Lost
them
them
all.
all. Yeah, and I guess that I don't have a close relationship with my siblings. Like, I don't really know them. So for me it would be almost like a stranger. And so when she said that, it really put me in the place where I could understand and empathize with people who had lost a sibling. And I think that was just the most powerful part of that to me.
I agree 100%. That line was like, whoa. And it was great. But I think the one thing that resonated with me was the one sister who had not only lost her sibling, but had also, much earlier in her life, lost her father at a very young age. And I was watching that, and it was her idea about not being willing to tell the story, and knowing friends and having close people to her that she hadn't told for 6 or 7 years that had no idea about her story. And I think that just honestly says so much about the stigma around mental health, and even when you're that close with somebody, you can't feel comfortable talking about it, which is why we're doing things like this. So that was a big line for me.
And how when she talked about how
Sorry, just so that the lives.
When she spoke as well, she spoke about how that perpetuated the cycle, and that she was part of the problem versus part of the solution. I don't think she used those words, but that really was what she was getting at, is by being not being able to talk about her story and share it openly, she was a creator of stigma herself. So
for me, it was a couple of things. I really, but more in relationship to my daughter's death than Steph, was like, I really related to the fact that you're just out there in the world and you're thinking, how can people just go on about their ordinary everyday lives? Don't they know what's happened? And then the other part of it was when, and despite the fact that I have a really strong network, lots of family I'm very connected to, tons of friends, and how difficult it was for me to tell them about what was going on with Stephanie, because I was conscious of her privacy, and she doesn't like the fact that, she doesn't want a lot of people to know she struggles with insight and awareness of her disease. And the other thing was, you end up lots of times supporting them because they're just not sure what to say. And then you relive the trauma of it every time you tell the story, which is not only difficult with your family and friends, but it's also really hard when you tell it over and over again to professionals. So that's really difficult. But I think that's part of this, the reason why, for me, that I didn't speak out about it a lot, because I wasn't sure what to say. and the reaction that I would have when I was talking to people who really loved and cared about staff and wanted to do the best they could around helping support them and to support me. So that was what really resonated with me.
Thank you. So we're going to take a break now. Not a commercial break, a refreshment break. So there are refreshments available in the atrium, and as I said, the washrooms are just around past the coffee and tea. After, we'll take a 15-minute break and we'll reconvene in here, and we will be joined by a psychiatrist and a psychotherapist from Vancouver Coastal Health, and there will be an opportunity for you to ask questions of them or of any of the three panelists here. If you would like to ask your question in writing, there are pieces of paper and pencils outside, and you can write them down. And if the question is for a particular member of the panel, please indicate that on the piece of paper. And then there will be mics around the room where you'll be able to ask as well. For our live streaming audience, in the next few minutes while we're having a refreshment break, you will be fortunate enough to be able to screen Suzanne's YouTube video called Hope, as well as another short video about mental health recovery. We'll see you all in 15 minutes. Thank you.
Vancouver Coastal Health, promoting wellness, ensuring care.
I believe that for people with major mental illness and addictions, the barriers to recovery are often external to them as individuals. I want to have a meaningful and purposeful life. I want to live in a community that sees the strengths of its members. Working with people who have survived and overcome some pretty serious obstacles is inspirational. What a privilege and gift it's been to learn from and work with some of the hardiest people on the planet.
I once heard it described as if you were looking at your life, meaningful relationships, fulfilling work, independence and happiness, all beyond a door that was locked to you. And you did this while you watched all of those around you blossom and grow.
Working with my team, working with patients, working with their families, I feel very, very humbled to be able to do it. It's an enormous privilege to be allowed into people's lives at a time that's very, very difficult for them.
When something is going wrong, when things aren't going well in somebody's life, who's there for them?
I started to realize I was getting better when I found out that there was other people like me struggling. What I got a lot of help from staff was being able to listen to me, hear me, understand me, and work with me.
If I would have walked into those 12-step rooms some over 10 years ago, and someone would have told me, you have to do this, you have to do this, you have to do this, I would have run away screaming.
It could be very easy to be perceived as being patronising or overbearing, and one needs to be very careful and respectful about that. But as well, one needs to be able to manage the relationship with the patient in a way where it's possible to say difficult things.
Not be like, oh, you're a drug addict, you know? That doesn't help, because that label, you stick to that label and you think you're that label, and you're not. You're a human being who is just struggling right now.
Stigma is a big barrier. The whole idea around how we label people, often it's taken in a pejorative way.
You can identify yourself as being an artist, a banker, an accountant, a musician, not as being a schizophrenic or somebody who is bipolar.
Recovery is focusing on supporting and working with someone to be who they want to be.
Sometimes it's really helpful to have the person you're talking to not say anything, but just listen, just really get, this is what this feels like.
One of the things I think is important to remember, for professionals to remember, is that good intentions is insufficient to provide trauma-informed care or recovery-focused practice. We have to look at all the tools that are available to us and how that can contribute to somebody's well-being.
I really need from staff is respect, to be there and to help me to find a solution, working with me to find a solution that will help me to get better.
From a systems perspective, it's about being accountable. And at the most fundamental level, it's about clinicians asking the question, am I being recovery oriented in my interactions with clients and families?
And so it's really getting input, valuing what people say, and also providing education so that people can really understand as an organization what we believe in.
It's about inclusiveness and partnership with families and the individuals we serve. It's about recognizing the strength of peers.
The clients tend to learn from each other in the group, and the messages are more powerful coming from their peers.
I never ever say, I'm the professional, I'm up there. No, I'm like, what do I learn from this person? Keep an open mind.
My recovery kind of started once I quit smoking, and things just started to change in my life. I had more energy, I felt better, and I found that I had enough energy for these things. So I had enough energy to work.
It's really finding the passion in the people, whether the passion's in the individual client, the family, the staff, or the leader, and trying to get them to lead through their passion around those values in the system.
To be able to get better means that I feel a sense of well-being. I find at ease with myself, that I can take on challenges and do what I want to do and be able to finish it, be able to handle it, and also to know my limit as well.
Families and recovery-oriented care for me is a no-brainer. Most people spend more time with their significant others, their loved ones, in their lives than they do in hospital and in our treatment.
I think families can offer to doctors and care providers a very unique perspective and unique information from their point of view and their intimate knowledge of that person who's ill.
There have been all kinds of issues that have come up with somebody not thinking properly, somebody not operating properly, and the family has been dragged through this as well. It can take months, it can take years for them to even realize that they're sick.
It is our responsibility as clinicians to create a culture of safety and partnership that puts the client at the center and asks them what it is that's going to assist them in making their recovery a success.
I really like that recovery journey path where it's sort of they're holding their lantern on that recovery journey path, and maybe they're feeling really fatigued or tired. That's okay. I'll take that lantern and sort of light the path for you. I'm going to hold it for you until you feel strong enough.
It's about how we are mutually going to be able to help the particular patient and the family achieve what they need to achieve or what they want to achieve.
Wherever they enter our system, it should be a seamless journey for them, whether they need mental health, addiction, or primary care services.
In my perspective, there was a time where it almost felt like the mental health team had to be the most important thing to clients that came to see us, but that's not the way it should be. I mean, we should be a pretty, hopefully a significant support, but a pretty minor part of people's lives, really. Their families, their friends, their work, their school, that should be what's really important.
To me, recovery is really about each of us living a satisfying life, no matter what that life looks like.
To me, recovery is a journey towards wholeness, personal happiness, choice and fulfillment, regardless of what symptoms somebody is dealing with.
I think ultimately the thing I've learned in the last 40 years is that your care is up to you. I didn't know what recovery was. I didn't know about the path I was about to embark on. I didn't know exactly where I was going. But I had to take that step. Nobody could drag me into it, and I think that's a really important point.
And that's what I think of when I think of a recovery-oriented system. It ties everything that we do, the nuances, the details, all the healthcare intricacies into the client's everyday life. And that's what makes it recovery-oriented.
Vancouver Coastal Health. For more, please visit us at vch.ca.
Hi there, my name is Suzanne Sagmeister, and I'm the founder of Conspiracy of Hope, a movement that was started to create conversation and awareness around suicide.
And I'm Rob Nash, a musician that's been traveling, and I deal with the topic of suicide through our music quite a bit. We were just one of the many musicians that got to be involved with this creation of this song as well as the music video. We hope you're inspired by it.
And now we present the song Hope.
You ever said farewell? Thought you turned off the last light. Walked down the boulevard of broken dreams in the middle of the night. Have you been shackled by defeat? Have you been drunk on despair? Standing frozen in your shame, feeling like nobody's there. I will be right here and I won't leave your side. Know you are worth it. Another breath, another try. I'll be the one you can turn to. Oh, you're never alone. There's always hope. It's in a smile from a stranger. It's in an old familiar song. A flower growing in the pavement, or the way the streetlight turns on. It's in the pieces of a mirror, all shattered on the ground. When you put it all together,
I know. And just have assigned seating or just sit wherever? So, where do you want to sit?
Just sit where it calls to you.
So they're both on.
So do you want to do Okay, let's. We should get going because these poor people are sitting there at home.
Yeah, we'll lose our audience.
I know. I'm ready. I'm ready, Bob. Okay, welcome back. If I could ask people to please take a seat if you're here with us in person. If you are at home watching, now is the time that you can put your popcorn down and put those kitchen dishes aside. And we're back live. So I want to welcome everybody back, and I want to say how delighted I am to welcome two more panelists to our power team here at the front. So 2 seats over from me is Dr. Cam Anderson. Cam is a full-time attending inpatient psychiatrist here at Vancouver General Hospital. And his clinical duties are split between the brief intervention unit, which focuses on people who are in an acute, very acute mental health situation or crisis, and the general psychiatry ward, which has a focus on treating people with more chronic, long-term mental illness. And in addition to his clinical duties, Cam is the associate medical manager of the general psychiatry ward and an active teacher of medical students and psychiatric resident physicians. He is a lifelong Vancouverite and completed all of his training at UBC. And he brings the perspective of a physician, a clinician, to the whole issue of how community and connectedness is really integral to recovery from mental illness. Next to me on my, fun fact about Cam, and this is actually a really good one. Cam has a 1-year-old who's what he calls male pattern baldness, which I gather is a better term than hereditary baldness, is even more spectacular than Cam's. He just whipped that off. Sandy Patola-Mosman on my left is a psychotherapist with SAFER, which is the Vancouver Coastal Health program for suicide prevention, education, and counseling. So Sandy provides group and individual counseling services to people who have survived a suicide attempt or people who are bereaved as a result of suicide. And Sandy's fun fact is that she grew up in Guatemala. So she hablas español, for those of you that are, like me, not bilingual. So we've had a number of people who've put questions together out in the lobby, and we're going to work our way through some of those questions. And we also have the opportunity for you to ask a question in person. So all of you have these tiny little microphones in front of you if you're here in person. And if you want to ask a question in person, then what I'm going to ask you to do is to raise your hand. And when I give you the cue, you turn on your microphone just by pushing that little white button in front of you. And at the end of speaking, the microphone can be disabled in the same way, just by pushing the button again, so that other people also have the opportunity to speak. But please don't turn on your microphone until I call you either by the color of your shirt or whatever, so that we're turning on the right microphone and we don't have more than one person turning on their microphone at a time. So I'm going to kick off with a question just to get things going here. And I'm going to ask, not everybody has to answer, but maybe I'll just ask whoever feels like chiming in, how, based on your own lived experience and professional experience, how attitudes have changed over the last few years in terms of our broader public attitudes about the stigma of suicide, and both from the perspective of what's been positive and what are some of the continuing challenges?
I'll jump in on this one.
Excellent, Tyler.
I actually
Thanks.
talked to Andrea from Safer about this on the air this morning. And the reason I wanted to talk to her about it, because I feel like over the last 3-4 years, there has been genuine progress in the ability to have these conversations. But what I wasn't sure of is that whether or not 3-4 years ago I was going through my own struggles, if I was just blind to how open people would be to that conversation at that point, or if there actually has been genuine progress. I feel like there has, and to be honest, that gives me a lot of hope. And I really appreciate the progress that we're seeing. That being said, there's still a lot of work to be done. But I feel like there has been progress. I would love to hear what you, as professionals, have to say about that.
As I've been working in the field, I guess about 20 years now, something like that. And it feels to me as well that there's been progress. One of the things that I think has been really interesting, and this is purely anecdotal, I don't know if there's actual research around it. To me, it feels like there's a lot more men coming into therapy and seeking out therapy. So not being pushed into it by their spouse or by their employer or WorkSafe or something like that, but recognizing that they're having a struggle and actually being willing to talk about it. And to me, that is really exciting and really hopeful, especially because I have a 17-year-old son.
Yeah, sure. In terms of being a physician, I've practiced for about 8 years. I graduated 8 years ago. And what I've noticed within my home community as a physician in like medical school through residency is that certainly over the past 15 years, it's much more, psychiatry and mental health issues are much more mainstream. People are more comfortable talking about it. It wasn't too long ago that I felt like, the lonely little early male pattern baldness student in the corner who was interested in psychiatry and felt almost ashamed of it. Whereas now I see medical students all the time coming in who are interested and engaged in the idea of being a psychiatrist or talking about mental illness, mental health in a way which was definitely not happening even 10 years ago.
No obligation.
No, but isn't that fascinating what you said about you felt, it's fascinating that you felt this own stigma yourself about being interested in the field. Like, how fascinating is that? Like, we forget that when we look at you, right? Because we see you as the doctor, right? You know everything. You're supposed to know everything. Fix me, right? But how you're still a human being, and I think that's a really important takeaway for a lot of people, to look at our healthcare givers and our helpers as people too. So.
Well, I haven't been involved in this area, as I mentioned, all that long. And it's interesting, I've had 2 different experiences with health authorities, and I have to say Vancouver Coastal Health is so much further ahead, and we've had so many more positive experiences. And for me, it comes down to leadership. It comes down to leadership with family members. It comes down to leadership with the individuals themselves. It comes down to leadership with the culture that you build within your organization and how you support families and people that come into your professional realm. So I think that's a really critical factor, is building a culture that accepts and doesn't judge and is kind and empathetic and professional.
This one actually got stirred up when you were talking, and it was kind of interesting because, so in my professional career, I spent a lot of time with musicians, and I got to go to rock concerts and shoot rock bands, and so everybody kind of thought me as the cool person. And so when I took on this project, it was very well received, and there was lots of hurdles and stuff, but I think I kind of lost my cool factor, and I say that in a way that I was no longer invited to like these fancy parties and stuff like that. I was invited to things like this that were more meaningful. So there might be a shift, like they didn't serve wine here. And we could
try that next time, but you'd have to move venues.
But the shift, I think, sometimes we're scared to talk because we're scared we're going to lose this person and this person. Well, this person here really isn't supposed to be in your life in that way, in that role, if they can't handle the real you. And I think that was such a significant thing for me. Like, yeah, I don't get to go do this, that, or another thing anymore because I'm the suicide girl. And but you get to do things that have so much more meaning and power, and to me, it's more rewarding.
Okay. No questions? Oh, yes. Oh, okay. Okay, can you just push the white button?
Yeah, can you
and
hear
ask
me,
your question?
please?
Yeah.
Okay. I watched the documentary and also listened as much I was able to each panel members. But all looked to me Canadian-born, well-established, fluent in English. I didn't see even one example of a refugee or an immigrant or a person from a different culture who are really struggling with mental health issues and a big stigma attached to suicide. Okay. I was wondering that if you have, if you could please just make, well, I will leave this with you. 3 questions quickly related to this. Do you have culturally sensitive services in the mental health system? How do services reach refugees and immigrant communities who are really the sufferers? Why? Because first they struggle with the language, with the culture, with their identity, with their different values, and it's kind of losing our children to the system because the system is not navigating to make a bridge between the parents and the children born and raised in this society. And the last question, do you have special programs to deal with people with mental health problems coming from war-torn countries, suffering from traumas?
Okay, those are all very excellent questions. And in fact, 2 other people have said on the little cards questions very similar to yours. If I can just quickly paraphrase what you said, in case the people at home couldn't hear, what your question essentially was how, in a very multicultural city and in a very multicultural province, how do we ensure that we're meeting the mental health needs of people from different languages and faiths and cultures, particularly when we have generational differences in how we talk about mental health and mental illness and stigmas weaved in around that? And in particular, what are the services that are available for refugees who suffer from the trauma of coming from conflict zones? Is that a reasonable synopsis of what you asked?
Thank you.
Okay, so I'm just going to ask maybe Sandy and Cam if you could just quickly answer that.
And you're right, it is absolutely a huge challenge. So I work mostly in community, and we do make an effort to hire staff that have more than one language, that come from different cultural backgrounds. And we've had over the, again, 20 odd years or something that I've been working in the system, there has been a lot of effort at educating staff to be more culturally sensitive. And it's crucial. It's absolutely crucial for us to find ways of engaging people that have such a different understanding, a different, not just language, but a different way of experiencing and expressing challenges with mental health, and to understand that, not just the words, but the experience and how differently that translates, how the thought process is different. With regards to the trauma, again, it's a huge challenge because for folks that have been an immigrant, I've been an immigrant twice, it is a long process of working through a lot of losses and changes and developing almost a new identity as you're adapting to a new country as well. And especially over generations, it can create huge challenges within a family. And then if you have mental health concerns on top of that, of course, it's extremely challenging. With the trauma particularly, it tends to be a long-term process of healing when there's been a trauma history. And we do, again, in community, try to be very trauma-informed. The jargon is to have a trauma-informed practice. And we are limited in the length of time that we can offer support to people. So I wish I had better answers. It is an ongoing difficulty in community. Yeah.
Sure. Sure. Yeah, no, I think that the point you're bringing up is very, very important in this multicultural city and province of ours. And I think that it's identified as a significant need that, to be addressed. And there are some avenues in which people from different cultural backgrounds or with trauma backgrounds can access care. That we have a cross-cultural psychiatry outpatient program. I think it's called VAST, which is for survivors of torture. I don't have them at the tip of my tongue, which maybe is part of the issue. But how we in the mainstream psychiatry community might address this best to start with is just recognizing that we can't actually understand and appreciate some of those facets of someone's background if they've come from a different culture. And there are family dynamics that I just can't understand. And I think by acknowledging that to myself first and to the person I'm working with, and then to their families, from there learning can go on, and maybe some of the stigma and the other cultural components that need to be addressed can at least start to be articulated, and we can build from there. But it's an ongoing issue for sure that needs to be addressed.
There's been 3 cards submitted that are all essentially the same question that I'm going to sort of weave them together. But the question essentially is, what do I do if someone in my life tells me that they're having thoughts of suicide? A family member or a friend, someone who's in a very dark place, is one of the ways that somebody described it. What are the resources that I can refer them to professionally, and what, as a friend or a family member, what do I do if someone discloses to me that they are suffering and they are feeling like they are at risk?
So first thing is to recognize that as soon as that person has started telling you and talking to you about their thoughts of suicide, their risk is going down. Give yourself some credit that you're a person that's safe for that loved one to open up to. And know that just by being there and being safe, you are already contributing to their safety. So step 1 is just saying, thank you. Thank you for talking about it. Thank you for being open about it. This must be really hard for you. I'm really worried about you. And I'm really glad you're talking to me about it. For Vancouver, and of course Cam and I are mostly familiar with Vancouver, being Coastal Health employees here, we're pretty lucky. We've got some very good urgent response that is 24/7 by phone or in person. You can drop in, you can call, and you would be talking to a mental health professional right away. So for folks that want more information, it's right out there in the booth there. The Access and Assessment Center. You can talk to a couple of the staff and get the phone number and find out more about what they do. And then often what happens from there is people are given referrals to kind of the services that suit them best, which could include VGH outpatient psychiatry services. And we do lots of stuff, counseling and groups and psychiatric assessment if needed. So that's often a really good starting place. And I think the crisis line also has a table out there. They're a fabulous resource as well.
Yeah, I obviously not a professional, but just from my own experience of not necessarily my father, but my own battles with depression, I think one thing that was super important was just being present It can be a very isolating feeling for a lot of people. And I think the first time that I told, at least my best friend was the first person that I told I was struggling with. And when I did it, I didn't expect him to have the answers. You know, I didn't go into that, and I don't think many people go into that thinking that all of a sudden their best friend's going to be a psychiatrist. It's not. But just the presence and the willing to hear the conversation and that support alone is huge. So I would say that's very important for a friend or a loved one.
I'm sharing this because I want to, have no stigma, and so that we can be all feel free to talk about it. My husband died of acute alcoholism.
Could you just go a little bit?
Okay,
Could you just go a little bit closer to the mic, just so
my
everybody
husband
can
died
hear.
of acute alcoholism 5 years ago, and I think he was impacted by his brother's suicide years ago, 40 years ago, when he probably didn't have any counseling. In fact, he did not have it. And his own mother would, cover it up by saying, oh, the brother died in an accident, without explaining. So can you talk about suicide, the impact, and alcoholism or other addictions to the survivors?
So the question was, how do you talk to the survivors, to those of us who are left behind? What's the help that what can we offer as help for those left behind?
The impact. Yeah. So my son's father, who passed away, was an alcoholic, and we were just actually having this conversation because my dad was a cop and he was also an ambulance driver. So not that negates alcoholism, that's for sure, but I didn't grow up around alcohol, and I was kind of dumb to the whole scenario. So I didn't know that he was an alcoholic until much later, and watching the process of understanding and explaining to my son that alcoholism is a symptom of hurt, and hurt people. And I think that any kind of addiction, whether it's Facebook, or whether it's food, or whether it's gambling, or whether it's sex, or whether it's alcohol or drugs, is just hurt, and it's a manifestation of the hurt. And that's my understanding, and I have a disclaimer that I do not have a degree, but I do have a degree in hurt. And I have felt the hurt of loss, and I think that intergenerational trauma is, it's coming more and more to the forefront now too, and the understanding of how that impacts. And what I speak about all the time is about how it's our job to heal ourselves so that we do not pass along and pour salt into other people's wounds and hurt other people because of our actions. And alcoholism, I think, is, again, hurt. Is a manifestation of the hurt.
In terms of the impact on survivors, certainly I speak with a lot of people who have had family members go through these experiences. I can also reflect on the experiences of being a clinician or being on a team in which losses like these occur. And some of the most painful aspects, I think, of being a survivor or being involved in caring for somebody who's completed a suicide is this idea that something was missed, that there's something I could have done. And those are the kind of things that you hear a lot. And there's something different about, I think as one of the sisters said up there, in the video. Well, that was weird. There's something different about a death by suicide compared to a death by heart attack or something. There just is. And what's difficult about that is you're left trying to with this sense of responsibility that I don't think you would have for someone who died of a heart attack, even though maybe they didn't take care of their blood pressure well enough, and it just seems very different. And I think that tendency towards blaming oneself and feeling like you could have done more, I think is a particular type of pain that I think someone needs to be supported and walked through and talked through. Unlike maybe how if someone had lost someone by a different type of illness.
I think my situation with like being a survivor of suicide is a lot different because of the time frame between when it happened and when I actually knew. I felt like I had gone through my grief of losing my father, and I had dealt with that at a younger age, and then learning the difference in it was a whole nother situation. And I think the biggest thing I learned in that situation was just that I had this mental image or idea when I found out that it was a selfish move, which is, you hear this a lot. And I think one of the biggest learning moments for me was learning that it's not necessarily a selfish move, which helped me deal with a lot of the anger that I was feeling about what had happened. Because in that mind, or in that state of mind, at least you actually can feel like you're almost doing your loved ones a favor, as you had discussed earlier, that you are a burden on them, and this is the best option for them, and it's not necessarily a selfish move in that sense. And I think that was really important for me to learn and figure out, and it made the process of being a survivor much easier after I grasped that concept, for sure.
I think one other thing that often comes up in the aftermath of a suicide death is that makes it different from other types of losses is there's often an element of trauma, because how that person has died and the suddenness of it, often people are plagued by images of what happened. There's so much suffering when someone is that ill, that desperate, that hopeless, coming up to the death, and then the death itself can often be quite traumatic. So survivors are left with processing how much their loved one was suffering, as well as the guilt, as well as all of the what ifs, in addition to just the pain of losing someone. So that can have a huge impact on someone's mental health. We know that losing someone to suicide increases suicide risk. We know that. Part of why SAFER does the bereavement work that we do, because we support people going through suicide, grieving a loved one to a suicide death, is because it is part of the prevention continuum.
The woman in the blue t-shirt, right here in the middle. Yeah, that's you, blue.
Okay, I have a question, but I also wanted to state there is another program for mental health people that would greatly impacted my life, because I didn't know till 2000, and I had suffered from a child, was Stand Up for Mental Health, which is a comedy group that helps people break the stigma of themselves. They can make fun of themselves. It's not just all about mental health, because we all have lives, because I'm a stand-up comedian. And my roommate, who had just had a kidney transplant, is in a documentary called Cracking Up. So if anybody wants to look at that and that about that. I just wanted to get that out, that there is other things. But I've also, years ago I heard that there's a genetic disposition to having mental health issues. I didn't know this. We had a traumatic event in my family when I was young, not like we wanted it, but I didn't realize till my mother told me when I was 16 that your dad's in a psych ward. My answer was, oh, that's nice. I didn't know what it meant. And then I found out that because I myself went through mental health, and I have kind of passed it on to my children. They have issues 2 out of 4, 50-50. But if you don't go through the trauma, like traumas or of other people, all of a sudden you just feel like this. Can that be genetics?
So the question is there a genetic predisposition to mental illness or mental health issues? And in fact, 2 other people said that on their cards as well. So that's obviously a question that's on a few people's minds.
Okay. I mean, there certainly is, depending on the type of mental illness we're talking about, there is a genetic predisposition towards mental illness for sure. And I think that how maybe that can be most helpfully viewed is that it helps us appreciate maybe a vulnerability that we might have in ourselves or in our loved ones. That might be a vulnerability that needs to then be supported and nurtured and not necessarily be feared and ignored or not talked about. So I think if one understands that, hey, I've got this particular illness that runs in my family, therefore it's important for me to learn about how I can best take care of my stress levels or get early signs that maybe I or my loved one is starting to have these symptoms, then all of a sudden that vulnerability or that genetic predisposition can then become something that is helpful and provides a better chance for support and stability.
I kind of want to, again, add on to that, not from a clinical perspective, but from a lived experience perspective. And I challenge the concept in just the literature that I have read and think about it as the fact that when I was going through the process of interviewing the survivors of suicide, I started to see lots of traits that I could relate to in people with borderline personality disorder on what I used to be like. And I started to understand that my way of dealing with things in the past, that I couldn't understand why I would deal with things like that, were traits of borderline personality disorder. And I talked to a psychiatrist once about the, like if you would have met me 10 years ago, I think you would have diagnosed me with borderline personality disorder. And we talked about why. And so I think my actions as somebody with borderline personality disorder, how I treated other people influenced like how I brought up my son. That completely changed now because of my awareness of my actions. And so I really believe that there's the healing portion in there that needs to take place so that you're aware of that vulnerability. My son's father was an alcoholic. Does that mean he's going to be an alcoholic? Does that mean he died by suicide? Does that mean my son's going to die by suicide? We talk about those things all the time, and I think that paying attention to addiction is such a vital trait. And like the girl said in the movie about, why aren't we talking about emotional well-being in school? So.
And personal finances was the other thing. The woman over there next to the gentleman in the fabulous blue sweater.
He's also wearing fabulous pants. I have a question, but I just want to make a quick comment. I've actually used the resource of the Access Assessment Center personally, and I found it really valuable. Just knowing that I had that phone number in my phone at any time I could call. And then just about supporting someone who's feeling suicidal, because I have in the past. I found it incredibly valuable for people to help walk me through very simple day-to-day things, like how are you going to get through the day tomorrow? Okay, so my question, I also work in inpatient psychiatry, and something I've been noticing is often there seems to be quite a strong stigma of medication, that I see patients being very reluctant to use like in the moment relief from a medication or to even try medications. And I'm wondering if you can kind of speak to the ties of stigma and medication and substance use from a pharmaceutical perspective and coping, and how that relates to the stigma of suicide.
That's a great question. And that'll be, I think, our last question, because I'm getting the look about time. Start with
That's a camp question.
And then maybe we'll ask somebody with lived experience to comment from that perspective.
Sure. I mean, I think it's a really interesting and probably pretty complex issue that you're bringing up around stigma within mental health, within psychiatry, and somehow that gets sort of like twisted into drugs and pharmaceuticals and abuse and dependence and all that. And so I think that it's very difficult for the lay society to know the difference between abuse of a drug or of a pharmaceutical as a crutch versus using a medication which then provides sort of a support or is part of a supportive framework that allows someone to recover and stabilize within their, with regards to their mental health. So I definitely, as an inpatient psychiatrist, do tend to use a fair amount of medication, sometimes as a primary avenue for stabilization and to help put someone in a position where they can then get back out into their life and build from there. Sometimes the medications are not primary. They play a very important supportive role. And I do find myself spending a lot of time speaking with a patient, a client, or their family, and a lot of it has to do with almost giving them permission and helping them to sort of reapproach the idea of medication, not as a crutch, nor as a magic bullet, but as something that is like dynamic and needs to be part of a kind of a comprehensive kind of plan process. Yeah.
I would just say from my experience, when I was first diagnosed with depression, I was absolutely terrified to take the medication. That was probably the biggest hurdle for me to get over, was actually taking the medication. I was very paranoid about how it would alter my mood and personality, and as someone who relies on my personality for my career, I couldn't have that change. So I took 2 weeks off work, and that's when I decided to try medication for the first time, was when I didn't have to have that pressure on. Now, not everybody gets that luxury, and I understand that. That being said, there's definitely a stigma around the medication. I think it just has to be, I call it your working solution. Like, I have multiple things that work for me. Meditation's a big one for me, which I never did before I started doing therapy and learning about these other avenues. And I think you're 100% right. It needs to be part of a much bigger package of a solution. That being said, I'm not a doctor, so yeah, sometimes.
That is something that comes up a lot, is I think people have a concern that a medication is going to change them or their personality. And my little joke always is, well, if there was a pill that could change your personality, it would be the most popular pill in the universe. I can think of family members now. So, so I think that is an understandable concern, and that's not really how I think it's designed. That's not how they work. They're really playing a sort of a supportive, structural kind of role.
So I'm going to ask a wrap-up question. With all respect to the professionals, I'm going to ask Suzanne and Tyler and Jane to just share if there's one thought or one idea or one offering that you could invite for the audience to take away tonight in terms of your journey or what you brought you to the point of sharing your story. Or how to help someone in all of our lives who's struggling. What's the one thing that you would offer people to take away from this evening, from your experience?
Right here, okay. I would say it's just the feeling, and I think this comes back to the progress that I feel like I've felt over the last few years. It's just there is hope. There is a lot of options. And as soon as I started to get involved in the conversation, I started to realize just how drastic it is and how many people have similar, it's never going to be the same, but similar stories, and how sharing those stories itself can be such a helpful thing, even if it's not with a professional, it's just with someone else who has a shared experience. The conversations going out here when I was walking to go to the washroom, or even in here with us between the panel, are amazing conversations that, for me, give me a lot of hope for the future, and I hope they can do the same for the rest of you.
For me, I feel that I talk about I get it moments, and how when you're with somebody and you're sharing your story, and it's that I get it moment that takes away the loneliness and that feeling of being alone. That is like, a bottle of, what's your best medication? Because it really is. And when somebody understands that they're not alone, it just wipes out so much. And just like, I just want to go back really quick to this woman here who stood up for minority and for refugees. And you're a change maker. Never, ever keep quiet.
I would say just be as present as you possibly can. Be present as a family member. Be present as a sister, a brother, an uncle, an aunt. Be present as a nurse, a psychiatrist. I know that often that's a little difficult, but just in my own experience, I'm just as present as I possibly can be. And even if, you know, Steph is saying she doesn't want visits or phone calls, I can text her, tell her that I love her, and that I'm there for her. And the other thing, can't take it personally, because if you do, it's really, it's going to backfire on you. So.
Okay. So I want to thank all of you for joining us on this very special evening. And I want to thank all of you who are watching live stream as well, wherever you are. I want to thank Tyler and Jane and Suzanne. Could I have a round of applause for the three of them for sharing their stories with us? And I want to thank Cam Anderson and Sandy Patola-Mossman for also being here tonight to offer both their professional and personal expertise. Thank you to both of you very much. And then, as usual, there are a whole bunch of people behind the scenes who made this evening happen. So Sabina really helped to curate the panel and to put the questions together for us. Susan, sitting there so quietly over in the corner, really put this entire evening together with the team from Vancouver Coastal Health. I want to thank Bob Baker and the Creative Connections team for giving us the opportunity to spread this message and the learning and the hope that we've shared here this evening with people from across BC. The BC Crisis Centre for being an important part of this evening. The team in mental health and substance use outpatient services at Vancouver Coastal Health, and the advisory committee, the Beyond Stigma Advisory Committee, made up of staff, professionals, family members, and people with lived experience who really helped to make this series one that's rich and hopefully meaningful and educational for people. We always are looking to improve the series, so if you have thoughts and ideas, there are going to be evaluation forms just outside here on the table when you leave. Please don't hesitate to fill it out and tell us tonight what worked, what we could do better next time. The advisory committee takes all of that to heart very, very much. It is just dusk outside here in Vancouver, but we are not going out into darkness. We are going out in a spiritual and emotional sense, I think, into light. Thank you, everyone. Have a safe journey home, and thanks for being with us tonight.